Is extreme period cramps normal? Hi, my name is Mfonikono. Welcome back to my channel, and today we'll be talking about the period cycle. Period, also called menstruation, is that time of the month when blood comes out from the vagina. This blood isn't dirty blood or anyhow kind of blood. It is blood and tissue from the uterus. So now inside the woman's body, the uterus prepares the woman's body where the baby will grow, just in case fertilization happens. And now if fertilization doesn't happen, that uterus, the lining that was prepared just in case fertilization happened, it's going to shed. Now that shedding is what we call period. A period usually happens after ovulation. If an egg is released and it's fertilized, the hormones drop. When these hormones drop, the uterus breaks down and it comes out as blood. Most people get the cycle every 21 to 25 days. Note, not everybody's body is the same. So the day your period happens to start is not the same day it might happen with your friend, or it won't be the same day. Normal period lasts between 3 to 7 days. Some people bleed lightly from the beginning to the end. Some bleed heavily for like the first 2 days, then lightly till the end. And note, all these are normal. It doesn't mean anything is wrong with you. So yours might happen this way, your friend's might happen this way, mine might happen the other way. So they're all normal. Many people notice changes before their period starts, and this is due to hormonal changes. And now some of these signs are lower abdominal cramps, also known as period cramps, breast tenderness, feeling emotional, sad, angry, it all depends. There is also mild headache, and all these are normal. And you not seeing these signs too is normal. Nothing is wrong with you. Some people feel fatigue, food cravings. So yeah, there are so many things you could feel which I have mentioned, and you not feeling it is normal. You not having these signs doesn't mean something is wrong with you. It's absolutely normal and okay. There's nothing wrong with you if you don't have the signs. And if you have these signs too, there is nothing wrong with you. You are perfectly okay. During a period, the uterus contracts to help push out the lining. This contraction is what causes cramps. Note that. The contractions is what causes cramps. The chemical that causes these cramps, or rather contraction, it's called prostaglandins. Some people have more prostaglandins, and now when these prostaglandins are high, the contractions become stronger, and that is what makes some people to have a more serious cramp. When I say more serious, I don't mean like very severe one, but it tends to be. That's why some people tend to feel cramps, some do not. So that's because those who feel the high cramps, that's because they have the high chemicals, prostaglandins. So that's why they are more prone and they more tend to have a mild abdominal cramps. This period cramps, this period pain, there's actually a name for it, and the name is primary dysmenorrhea. That's the name the period pain we feel is called. Severe pain normal. Now, even in my daily life, I would say personally, I've never had a cramp that would stop me from still doing my daily work. Although there's sometimes you feel the pain, maybe a slight pain which feels a bit severe. I don't think I should use the word severe, but the whole point is it will not stop me from doing my daily activities. So now if you should feel a severe pain that's not allowing you to go about your daily life, trust me, that isn't normal, and your body needs attention. You only feel a mild moderate pain where certain things you do will help reduce it. But if it's that severe pain that makes you so uncomfortable, although period cramps are uncomfortable, but uncomfortable to the point you can't do anything. No, 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 no. Your body needs attention. Vomiting and fainting too. They aren't normal. Vomiting cause of the pain, fainting cause of pain. Bro, that isn't normal. I'm sorry for that word. They aren't normal, I must say. And changing your pad. Changing your pad every hour isn't normal too. Because that's actually excessive bleeding and it isn't a normal thing. So all this still means your body needs attention. Although severe pains like this leads to certain conditions like fibroids, pelvic infections, hormonal imbalance, also ending to your body needs attention. It's not really a severe case, but it's something you should go to the hospital and go check out. It's to my own personal experience, because the things I've mentioned, they're actually general signs, general effects. Now, me personally, before I have my period, definitely my mood is going to change. I tend to become angry, emotional. Let me use that word, emotional. I tend to become more emotional, and I definitely feel cramps. I have cramps before a day before the period comes, almost definitely. In fact, not even a day before. The cramp lasts for like 2 to 3 days, because my period lasts for 4 days. And yes, let me use this moment now to tell you that there are ways you could relieve the pains. Now, the ways I relieve my own pains is by taking hot tea or hot water itself. So now some people, not even some people, other ways you could relieve your own pain is by maybe soaking a towel in the hot or warm water, then placing it on your abdomen for like 10 to 15 minutes. That helps. Now, taking medication too. Common medications like ibuprofen, paracetamol, those are the ones I take, and those are the ones that is general too, I think. Now, there are some certain beliefs. Some people say that taking medication isn't good, it will damage your womb. Please, they are false, except you are taking something that isn't meant for that. Like the two medications I've mentioned there, I think those are the only two commonly used medication for pain relief. So anything outside that, that's when you could risk that. But if you are using these two I mentioned, there's actually nothing is going to happen to you, please. Yes. So I think I've mentioned the few I know and a few general ones I know of. See that red jelly-like or liver-like stuff that comes out during your period that stains your pad? That is no problem. That doesn't mean something is wrong with you. That is just a normal blood clotting. So it's a normal thing and you shouldn't be scared or afraid of it. It's nothing serious, it's a normal thing. It's excessive bleeding. When I say excessive bleeding for more than 7 days. It's not normal, please. Go check your body out. It's absolutely not normal. And you not bleeding too. If you've not seen your period, like if you should go like 2 months without seeing your period, it's not normal. Especially if you're engaged in, so you'll have to go check, go take a test to know if you're actually pregnant. But I think that would be a topic for another day. So thank you so much for watching this video, and if you found this video helpful, kindly like, comment and subscribe to my channel. Thank you so much for watching. See ya in my next video.